Welcome. This video recording will walk through the patient self-check-in process. Patients will receive this email prior to their virtual visit with your care center. This will allow them to go through the process to ensure that their computer is up to date with the appropriate technology they need for the virtual visit. They will go through basic demographic information, update any changes to their insurance, as well as go ahead and pay any co-payments that are due for the service of a virtual visit. This email will come through to the email address that we have on file on the patient's quick view within Athena. From here, it comes through as a virtual visit appointment notification. To kick off the self-check-in process, the patient will click into the email. Within the email, they will find a picture of the provider they have a virtual visit scheduled with. They'll also see a confirmation of the date and time for the appointment, a phone number to contact our team, as well as a couple areas covering exactly why they're going through the self-check-in process. It will let them know ahead of time that we're going through this information to ensure that you're able to start the visit on time. This will check to ensure that the computer is equipped for a virtual visit and will also confirm their insurance. We will also collect any appropriate payments for the virtual visit at this time. Additional support services are outlined here as well. And of course, we always want to remind the patient that if they need to cancel or reschedule their appointment, to please contact your office at least 24 hours before the appointment. To start the check-in, they will choose Start My Check-in. Once clicking Start Check-in, the patient will find an outline of areas they need to go through prior to the visit. The first one being an audio and video test. It will show over to the side that this is needed at this time. The next item down on the list is consent for treatment form. It looks like we already have one on file for this patient. Next is their insurance, which shows that it is needed, and payment information is needed as well. They will click through each of these individually. Once viewing the areas that they need, they can scroll down to the bottom and choose Get Started. First, it will walk them through audio and video test. This will allow the patient and the provider to hear each other over the virtual visit as best as possible. Step 1 is, do you hear a ping sound when you click the play sound button? If the patient does hear the sound, they can choose yes. Scrolling down, the next question is, do these bars change when you speak? Once again, they will choose yes or no. And then lastly, video. Can you see yourself in this video? They'll move down, choose yes or no, and then select continue. Next, we will go over insurance plan information. The patient can choose that they will pay out of pocket for this plan, or they can scroll down and add their insurance provider. Next, the particular insurance plan, their group number and member ID, and the copay amount listed on their card. Next, they will enter their billing information. And they can also select that they would like to be emailed a receipt. Last, they'll choose the big blue Submit button at the very bottom. If the patient is doing self-check-in immediately prior to their visit, once choosing Submit after putting in their payment information, it will take them directly to the virtual waiting room. See here, our provider is ready to see us. We see that we are meeting with Dr. Meredith Josephs, and when the patient is ready, they can choose Join Visit. If the patient is completing self-check-in days or possibly hours in advance of their visit, they will simply be navigated back to a completion page and they can choose to click out of their web browser. This concludes this video tutorial.